So today we're going to be assessing Matt's abdominal and renal systems. So as you can tell, Matt's knees are bent, his hands are by his side, and we had him urinate before to empty his bladder, so there's no bladder distension in the abdominal area. So we're just going to look across the area. We're going to inspect it for any peristalsis or pulsations. You can't see anything. We would assess the area for scars and then umbilical hernias. And so now we're going to listen. And we're going to listen with the diaphragm in all four quadrants. So his bowel sounds are normal, and we're also going to listen with the bell of our stethoscope for any bruits. Okay, so now we're going to percuss, and it should be tympanic. You may hear dullness down here, but we don't. That usually means that the bladder's full. Alright, perfect. And so now we're gonna do the hooking, which we forgot to do earlier. So we're gonna feel around his rib cage, alright. And Matt, I'm gonna have you take a deep breath. So we don't feel the spleen, and now we're gonna feel for his liver. So I'm gonna have you take a deep breath, which we don't feel the liver. And we're also gonna percuss for it. So we're gonna start up here, and we're gonna go midline and percuss. And once we hear the dullness, which is right here, we're going to mark it with tape. And then we're going to start down here and percuss for dullness. And so that's right here. And then we're going to measure that. So your liver is 7 centimeters, and the normal is 6 to 12, which is good. And then also, we would do the same thing on the side for the spleen, just to see if we hear any dullness, which we don't. Okay, Matt, today we're going to be teaching you about testicular self-exam. So it's best to do it after the shower when you get out, when your scrotum is very relaxed, and you can assess the scrotal skin for some swelling. You should place both hands on each testicle and place your index finger and your middle finger underneath the testicles with your thumbs placed on top, and then firmly and gently roll the testicles between your thumbs and your fingers and feel for any irregularities or surfaces on the skin, like any lumps or anything. If you do find anything, you should follow up with your primary care provider so they can assess it even more. But yeah, so it's just good to do that. And then also I'm going to be teaching you about self-breast exam. So you want to do that once a month, and you want to check the entire breast area and the armpit area. You should do it after the shower, or you can do it in front of the mirror laying down, and you want to place the pads of your fingers around the entire breast, and in a circular motion move them around from the outside to the center, and feel for lumps, thickening, or any hard knots. And like I said, if you do feel any lumps or hardened knots, to follow up with your primary care provider.